Welcome everyone. It is 9 o'clock, just turned actually, so we will start. Thank you all for coming. Appreciate your attendance, and Simon, two Simons online. Welcome. Um, Apologies and changes in membership. Do we have any apologies, Marie, please?
Yes, we have apologies from Wendy Pereira. We have apologies from Laura Godian, and I believe Simon Holmes is here substituting. Emma Karina sent her apologies, and Jo Dare is here substituting her. I'm not aware of any other apologies.
Okay, thank you. That's all well noted. We'll press on. To the minutes, for those that were here, to confirm the true record, the minutes held on 26th October. Can I have a proposal, a second of those? I don't know who was there here. Yeah, Michelle.
I was here.
And Simon. Thank you, Simon. Simon B. Those in favour of approving the minutes, please show. This is a small number. I was there. Ashley was. Yeah. Okay. That's okay. That's okay. Thank you. They're approved. Declarations of interest. Declarations. Then I will just remind the board that I have a declared interest as a member of this board, and on any matters or questions that arise involving directly care provision, I will not comment or vote on at all. Thank you. Public question time. Do we have any public questions? Yeah.
Chairman, we've had some submitted, and I believe Councillor Andre has the questions and the answers. It doesn't look like there's anyone in the public gallery.
Oh. Ian, do you want to ask your questions? I mean, yeah. We've had them, but I don't think all of the board members have had the questions. But for this, I will pass over to Michelle, Deputy Chair, just to deal with this, these questions. Thank you.
Thank you, Chair. Do you want to, how many of the questions are from you, Ian?
3 from me, yeah.
Okay, do you want to ask your questions, and then Councillor Andre's got the...
Do you want me to do them one at a time or all in?
All 3, please, Ian. Thank you.
So question 1, can you provide clarity on the disparity between the government assessed fair cost of care and the rates currently offered by the local authority? Question 2 is, what plans or timelines are in place to align the fair cost of care and local authority care fees? And the third one, could you explain the disparity between the local authority care fees and self-funding fees that people pay individually, and whether there are any plans to ensure we have fairness and sustainability in the care market?
Thank you for your questions, Mr. Bennett. In response to question 1, the question asked related to the National Fair Cost of Care exercise, which was initiated by central government. The Department of Health and Social Care required that all local authorities undertake the Fair Cost of Care exercise in September 2022. The outputs of this exercise were returned to the Department of Health and Social Care, and the results were published. The result of that exercise remains available on the Isle of Wight Council website, along with the analysis. However, there were significant caveats and assumptions in the analysis, as in accordance with the requirements of the Department of Health and Social Care. The exercise related only to service provision for people aged 65 and over. In addition, of the 48 residential and nursing care homes on the Isle of Wight that were in scope as part of the exercise, only 23 provided a response to the exercise. In some categories, there were insufficient returns to complete the analysis. The exercise also did not consider care and support from other funding streams, including continuing healthcare or funded nursing care. It is acknowledged that the median figures identified in that exercise are higher than the funding currently provided by the local authority. The Isle of Wight, however, is not an outlier in this regard. The local picture is reflected nationally. The government guidance for the exercise was that local authorities should work towards this, not that it would be possible to do so immediately. Although the fair cost of care exercise was a central government initiative, no additional funding has been provided to support local authorities to support the move towards the median figures. In addition, there has been no feedback from the Department of Health and Social Care on the aggregated results from the local authority returns. There has been learning from the exercise, and there are elements that have been used and incorporated in the current fee setting processes. These include, but are not limited to, staff cost and non-staff cost splits, which allows better and more appropriate application of various inflationary uplifts to different areas. In answer to question 2, the local authority has been committed to working towards a fair cost of care as identified by the national exercise for the provision of care across the Isle of Wight. This year has seen the highest value in budget to support fee rises for providers in the year 24-25. This follows what was the highest increase previously in 23-24. Across both years, the increase in funding to support the increase in fees for local providers has totaled in excess of £8 million across the 2 financial years. The Isle of Wight Council remains committed to working with the independent sector to support the continued move towards the fair cost of care through the annual fee review process. In answer to question 3, the disparity between the rates of those who self-fund their own care and support and those who are funded by the local authority is a national issue and not a local one. This is compounded as the government has also put a hold on the work regarding the care cap. Without a long-term and appropriate central government funding strategy for adult social care, this issue is likely to remain an issue. Thank you.
Thank you. We've got 3 further questions.
I will read out the questions because I don't believe that the person is here. So we have 3 written questions from a Ms. B. Davis on behalf of Sandown Nursing Home to the Chairman of the Health and Wellbeing Board. Question 1. What is the current capacity for accepting new care placements at the rates provided by the local authority compared to the total available capacity? How does this compare with the number of people currently awaiting discharge from hospital into care settings? Question 2. What is the current capacity for, I think question 2 actually is the same as question 1. It reads exactly the same as question 1. So I will go on to question 3. How does the board ensure that the quality of care remains high despite the financial constraints imposed by the current local authority rates? Are there any quality assurance processes that might be compromised by these financial pressures? The response to question 1. According to the latest circulation of the capacity tracker, is a national tool which local providers are required to complete on a regular, no less than monthly basis. As at the 17th of the 4th, 2024, there were 64 available residential placements and 38 available nursing vacancies on the Isle of Wight being reported through the capacity tracker. The availability, as you would expect, constantly changes, and as a result, this is only a snapshot of availability at the time the data is inputted by providers. In addition, this does not provide a breakdown of the capacity that is available to the local authority, as providers choose to retain some of their capacity for people who fund their own care and support and are able to pay higher rates. The local authority also makes contact directly with providers regarding their capacity on a weekly basis. Locally, we find that when we make direct contact with the homes, the number of placements available are generally lower than on the capacity tracker, despite both having figures provided by the providers. The latest local authority vacancy list showed 23 residential placements available, 10 of which would accept local authority rates, and 6 nursing home placements, 3 of which would accept local authority rates. The level of nursing capacity currently looks lower than it actually is. In order to support hospital discharge, the Integrated Care Board has block purchased additional capacity to provide support. This additional capacity is not shown within the vacancy information. The number of people currently awaiting discharge also varies, and not all have care and support needs. During a recent review week, which took place at the hospital, and which was designed to understand the challenges around discharge, the following data was gathered. 2 people were awaiting care and support in their own home. Arrangements were being made. 14 were awaiting short-term residential care and support, of whom 2 had arrangements in place with plans in place for their transfer. 4 people were awaiting short-term nursing placements, of whom 1 had arrangements in place with plans in place for their transfer. In addition, there were no care and support needs and others with onward care and support needs, which included a mixture of awaiting community rehabilitation beds, reablement, and non-weight-bearing support. This cohort of people would not require the capacity identified. On to question 3, as question 2, as I said, was a repeat of question 1. The local authority has a quality assurance framework, QAF, in place. The quality assurance framework was co-designed with local providers and the Integrated Care Board. It draws on multiple sources of information and intelligence in order to prove assurance around the quality of care provision and provide the local authority with the ability to monitor delivery. The components of the quality assurance framework include a provider self-assessment, quality assurance visits, sharing of information with the Care Quality Commission, the CQC, sharing of information with health and safety organisations, the monitoring of reporting in relation to falls, medication and safeguarding. Care provision is then RAG rated based on the assessment and analysis of the quality assurance framework information and monitored with appropriate action being taken as required. In addition to the quality assurance framework, each local service has an allocated commissioner who makes fortnightly contact to ensure that any issues or risks are raised and can be acted upon quickly. We do not anticipate any of the quality assurance processes being compromised by financial pressures. Thank you.
Thank you very much.
Can I just, I will double check the questions that were raised by Ms Davies and make sure that question 2, if it is the same, and make sure that she gets a proper written answer on question 2 if it's different to what. So I just wanted to put that on record.
Thank you all make sure that's documented, and hand back now to Chair for Chair's update.
Thank you, Michelle. I appreciate that. Thank you for your perseverance. Thanks for the questions, Ian, and the responses we've given. An announcement from me, I will read this. It's listed as a chairman to give a verbal update, but it's an announcement. So the Health and Wellbeing Board remains an important meeting in the island structures to oversee issues of health and wellbeing. As the Health and Care Partnership has developed, we are reviewing the role of this board in conjunction with the Health and Care Partnership. Since the last meeting of the Health and Wellbeing Board, Cabinet has approved 2 papers that will have a positive impact on health and wellbeing. First, signing of the smoke-free pledge, which demonstrates that the council is committed to reducing smoking prevalence on the island. Similar declaration was signed off by the ICB at the end of 2023. And as a board, we are reviewing the legislation going through parliamentary process for a smoke-free generation. Now, this will positively impact on the health of island residents. All parties should consider their responses and actions required. The second paper was the independent report by our Director of Public Health, Simon Bryant, on childhood obesity, entitled "Let's Not Wait, Time to Tackle Health Weight," with a different spelling of weight and weight there. Let's not wait in time, and time to tackle health weight in weight, WEIGHT. A workshop is planned to bring partners together to take forward action on this important issue for our children and future generations' health. The board should note that the Hampshire and Isle of Wight NHS Foundation Trust, their Project Fusion, start has been delayed to the 1st of July 2024 for the transfer of community and mental health services to the new organisation. And finally, the ICB is currently in consultation about its new structure. So that's my announcement. Don't intend to take questions on that, but we'll move on. Item 6 is go on then, Debbie.
If I may, Chair, just to add to that, I think the relevance of the transfer on the 1st of July is that it's the childhood and adolescent mental health service that is transferring, which obviously is the transition phase, which feeds into the annual report from the Director of Public Health in terms of childhood obesity moving forward. Thank you.
Thank you for that clarity. That's helpful. Item 6 is tackling health inequalities, and it's for us to discuss inequalities across the island and actions being taken by all partners. Simon, is there something you want to speak about on this?
Yeah, many thanks, Eden. Firstly, apologies, I couldn't be there in person due to a personal medical appointment. I've got a few slides. What I really wanted to do, the Health and Wellbeing Board has a responsibility for thinking about health and well-being and tackling health inequalities. So for me, it was how we come together and really think about these issues and talk about them. So I've got a few slides, and colleagues from around the partners have put their thoughts in so that we can then have a conversation about what are the key actions and really just understanding each other's priorities with regard to health inequalities in this space. So I'm grateful for colleagues for their slides that they sent through, and apologies that they didn't come out with the papers. Marie, I'm sure we can put them online afterwards. Just a quick kind of, what are we talking about? It's the ultimate differences between people's health and thinking about health status, might be access, might be about quality of experience, those behavioural risk factors and the wider determinants of health. So it does involve all of us in different ways. I'm grateful for people like Colin Rowland as Director of Communities to really play his part in those wider determinants. But all of us need to think about how we tackle health inequalities, because if we don't do that, we are not going to improve the health of our population, which is our role. And between who has health inequalities? It might be someone's socioeconomic factors, so where their income or where they live. We know that there's inequalities from the island to the mainland for some things, but also within the island. Let's not forget that different parts of the island have different challenges. Those characteristics of our population that may have worst health outcomes, we saw that really clearly in COVID with some of the BME populations having worse outcomes from COVID. And then those people who are socially excluded. It would be remiss of me not to bring up what we're doing with our JSNA, so that on the JSNA we have Inclusion Health Groups of the Isle of Wight, which really starts to identify those people on the Isle of Wight who may be experiencing health inequalities. A wide variety of groups there. Some of them are quite small, but that might mean that we need to focus even further on those populations. So we have a JSNA, we need to use it and we need to really question it and welcome comments from the board on the JSNA and what further analysis we need to do to understand health inequalities. And we had a presentation at a closed workshop, I think it was the meeting before last, where we really dug down into our JSNA. So if we just move on to different inputs, and sorry, peering into the screen, Colin, I don't know if you want to talk about economy and infrastructure, and we can then kind of go through 2 slides from each person and then have a conversation.
Thank you, Simon. This is a very interesting subject area for me, having been an environmental health officer by training. So the links between health, environment, and the work that we do as a local authority in partnership with all sorts of other agencies as well is really important in this aspect. What I wanted to do quickly is just do almost like a whistle-stop tour of where our links are, the services that we provide as a council, but also, again, I'll talk crucially, is the services that we have to provide in partnership. The council is a deliverer of services, but also, given we're the democratically elected representatives of the island, we're the sort of holders and the people bringing partnerships together to deliver on agreed outcomes. And this board is a classic example of this, that the council has an input into it, but it's also dependent on the other people around the table to be able to enable us to do that. Coming quickly on investment, infrastructure and urban planning, we have an island planning strategy, incidentally, which we're seeking approval for on the 1st of May at our full council. It's been a long process, but that sort of planning strategy talks up in terms of how that investment and infrastructure and urban planning will be developed and how that can make those beneficial effects on people's health. 15-minute neighbourhoods is something that's bandied about. Infrastructure being within the local area, encouraging active travel, encouraging people to feel part of a community. It's all part of the planning system that we try and encourage on the island in that respect. Invest in supporting connectivity. We have a local transport plan that we're actually developing. Again, it's trying to move away from the need for a car or a vehicle to actually get around, and actually encouraging people to travel actively, which again has a beneficial impact on health and on people's well-being. Supporting inward investment at local businesses, the links there between economy, prosperity and health, and the need for us to develop the island economy. And we have an economic development strategy, which again is one of the pillar strategies that supports other outcomes that we're trying to achieve on the island. Education and training, again, very, very important in that respect as well. Climate change mitigation adaptation. We have a council climate change strategy, which effectively is how do our services and how do we as a council impact on climate change and on reducing carbon. But we also have a council, an island-wide climate change strategy, where again, as a local authority, as an enabler, we are encouraging groups, organisations, agencies and individuals to try and aim and go towards that net zero outcomes that we're trying to achieve. It would be remiss of me also not to talk about the biosphere and the biosphere objectives, which fit alongside those social, environmental and economic activities as well. Coming down to other sort of specific services that we deliver, physical activities and active travel again. We've just recently been successful in getting a £14 million grant from the government to deliver a greenway strategy, which effectively is a active travel and transport strategy that connects the east and the west of the island. And that has benefits for residents, has benefits for businesses, but also has benefits for our tourism economy, which again feeds into that economic development cycle. So we're looking at virtuous circles in terms of the activities that we're trying to encourage and the outcomes that we're trying to achieve, which achieve those overall outcomes going forward. Public transport provision, we've just been successful in some funding from a zebra fund, a government zebra fund, which we will be providing towards Southern Vectors investment for 18 electric vehicles on the island on specific routes. So again, we're tackling that issue about encouraging public transport. We're also looking at clean air in terms of the development for that. So for the buses that aren't going to be electrified because of certain aspects of the way that they run or the topography of certain aspects of the island, the better quality engine vehicles will be actually used in those areas and the electric vehicles will be coming in and replacing more polluting vehicles. So Euro 6 engines, which are the most efficient vehicles, will be actually coming to be ubiquitous alongside the electric vehicles on the island. We're very positive there. Electric vehicle charging, we've been given a significant amount of funding by the government to actually encourage electric vehicle charging, both for residents, but also in terms of electric vehicle charging collective points that we can actually try and encourage that infrastructure. And the government are supporting us on that. And we're looking at a project to actually deliver that a lot more effectively. Public realm and natural spaces. As a council, we are responsible for quite a number of public spaces, and we also support parish and towns in the public spaces that they deliver and manage and monitor as well. And the health benefits of people getting out into the open air, making use of public spaces, the mental health aspects of open spaces, etc., are well known, and that's the sort of thing that we want to encourage. There is a note of caution there in terms of the funding that we've had as a local authority to support these activities has reduced significantly because they're not seen as statutory activities. They're seen as something that we provide as a council, but we are looking at innovative ways of actually increasing that funding, working with the parish and town councils, working with community groups to actually improve those public spaces further and to make sure they're readily accessible for people. That also includes encouraging community groups, encouraging sports clubs, and encouraging other active groups and individuals to make sure that we make best use of our assets that we have, which are owned in common, but managed and maintained by the council. The other aspects that we've got are community meeting centres, including libraries, museums, and other activity areas. Again, that social aspect and the beneficial aspects on mental health and well-being and on health and well-being of bringing people together socially and enabling those activities. Plus, again, working with the town and parish councils on a close basis to make sure that we fill the gaps that might be in provision, as well as working with community groups and voluntary groups in that space. So, as I said, very whistle-stop tour. We can't deliver it by ourselves. We can't deliver it with the funding that we have on our own as a local authority. So therefore, we have to work very, very closely in partnerships and recognising and working very closely with Simon, for example, in public health, the benefits that we have in health prevention. We have an MOU with Simon and his team where they actually fund certain aspects of the activities that we carry out because of the the benefits to public health and the benefits to this sort of arena in which we're operating. Education providers, we need to work very closely with them in terms of our economic development strategy and bringing on the right education and training for our young people and for people throughout their lives. Working with town and parish council groups, I've mentioned that before, working and encouraging businesses and third sector enterprises to ensure that we are building our economy in an effective way, and investing in local place plans. One of the things that we're looking at is Sandown, Cowes, Ryde and other particular towns, working very, very closely with them to encourage place plans that look at the benefits that we can bring to health and well-being in that aspect. And one of the exciting projects that we're actually encouraging is a Ryde Town Plan, which is £20 million over the next 10 years to develop projects in Ryde which relate to infrastructure, relate to community safety, but also the health benefits that we can create in developing the environment and the economy of Ryde as a place. It's unfortunate that we haven't got that money for the other towns in the island, but we are pushing DLUC on a constant basis on the needs to actually encourage that sort of development that has that inclusive outcome-based focus that we can work with individuals, groups and the town and parish councils to develop this. Central government initiatives should have a strong public health component, and I mentioned the Greenway, I mentioned the Right Town Fund. The other one to mention is a safer road scheme on the A3057, which we've had funding from government to look at road safety, to look at safer road crossings, to look at speed and other elements that we want to improve that experience, not just for motorists, but for pedestrians and for other road users such as cyclists. So it's another thing that we're actually looking at that again feeds into our local transport plan, which again, there's that sort of encouragement of people away from motor vehicles. But what we also want to do is to make sure that motor driving and motor vehicles are safe in that respect as well. So very quick whistle stop tour. I'm happy to take any questions. I think it might be as a suggestion that some of these topics we could actually come along to a future meeting and talk about in quite detail. I mean, for example, the leisure services provision that we provide, unlike lots of local authorities that have given their leisure provision away to an arm's length company or a trust or a private operation, we still operate our leisure facilities for the outcomes that we're trying to achieve overall, like for the health outcomes and for the other benefits that we achieve through that. And as a result, that costs more. It will do because of provision, but we are working post-COVID because we were operating a surplus with our leisure facilities. We're now operating with a deficit, but we are working to work that deficit down because we see as a local authority the benefits that provides on top of just providing a gymnasium for somebody or on top of providing a swimming facility. It's all the other benefits in inclusivity which we include within that particular service. So that's quite a whistle stop tour. As I said, happy to take any questions and I'd welcome to come back and talk about some other issues in more detail.
Colin,
Thanks.
thank you. Oh, sorry, Chair.
Sorry, yeah, go ahead, Simon.
I was just going to kind of talk through the presentation. So I was going to do one slide, and I think we're going to move on to Simon for adult services, and then Ashley, then the NHS. So from my perspective, public health services are all proportionally universal. So that means we have a universal service and we have a targeted service. For example, we actually pay more for people to give up smoking who are in groups with high rates of people with serious mental illness or people from particular groups of workplaces or things like that. So we're really trying to think about how do we, as Colin said, there's lots of services we provide and lots of interventions, but how do we make sure and support those people who are less likely to have good health to access and enable to be benefiting from them. So that's my quick slide. I'll do it. Simon, do you want to talk about adult social care and housing?
Yes, thanks, Simon, and hi, colleagues. Good to see you all. I just wanted to bring into focus some of the work we're doing in adult social care and housing, which clearly links to our health inequalities, and more importantly, the key actions that we're taking. So adult social care and housing strategy development is very much aligned with our local trends and demography, ensuring that people have the right support at the right time, and that support is in the right place. And this is very much linked to the JSNA. What we do need to do and increase our activity in is to provide better support for unpaid carers through the carers passport. We've recently appointed to a carers officer role. We'll be working within our front door team, which will provide much better direct access to advice, information and guidance. And obviously then that direct support for care is much wider on the island. We work a lot on co-production, ensuring local people, their wants, needs help shape everything we do. By saying everything we do, I mean that informs our commissioning, it informs our social work practice, informs a lot of our processes and our systems, and we need to make sure that we continue that really fantastic work. The redesign of our front door, we're creating a wellbeing and access team. What that will do is improve signposting and really connecting people to the community and the resources they have around them and the universal services that are within the local community. This front door will provide an increased focus on early help, and again connecting people with community groups to help prevent that social isolation. Improved access to self-service and self-assessment, a really key area of focus for us going forward, to enable those who choose to have access to a digital assessment, for example, or a digital eligibility, like you would expect in some private sector organisations. Our practice focus, so the focus of our social workers who are out there in our community, has to have the wellbeing at the heart of everything they do, whilst ensuring where possible people have strong links to the community with a solid focus on prevention. Strong practice with children's services colleagues, ensuring vulnerable groups are well represented and transitions are effectively managed. And we've had some recent very productive meetings and conversations with children's services colleagues on how we join up together some of our strategies and some of our practice. Another area that I wanted just to highlight, and a key theme for us, is the carers that we have on the island, roughly around 17,000 unpaid carers. And some of the themes we've got from our regional surveys are in front of you here and are pretty self-explanatory, but you can see that 48% of carers surveyed within the southeast region say they don't have access to physical activity. It's not prioritised. So again, more to do in this space. Our carers Isle of Wight provide gym sessions for carers once a week, but we could do more in this space most definitely when we work together to look at this space. Again, mental health. 26% of respondents of the Carer UK survey describe their mental health as bad. And another theme is around loneliness. 77% of carers in the Southeast survey said they felt lonely. And evidence on the Isle of Wight suggests this is similar as well. Again, Carers Isle of Wight offer group sessions with peers, sometimes based around shared activities, such as art and crafts, for example, or trips out in the community. But I think together, working collectively, we could come up with more we could do in this space to overcome some of the key issues for carers locally. That's a whistle-stop tour from me, Simon. I hope that helps, and I'm obviously happy to take any questions, comments once we finish the other slides.
Brilliant. Thanks very much, Simon. And I think we're on to Ashley.
Hello, everyone. This is my first Health and Wellbeing Board meeting. I'm Ashley Whitaker. I'm the Director of Children's Services at the Council, and I joined on the 1st of February. So there's two slides from me about some health inequality matters relating to children and young people on the island. And I thought I would share some of the data from a survey that was done, the Be Well survey that was done with children and young people on the island last year. And I could have chosen a number of different groups to look at health inequalities on, but I've chosen to look at it across gender, those children accessing free school meals, those with special educational needs and disabilities, and just a comment really about children who are in care of the local authority or care experience. So the first one is around gender. So something that when I was looking at the data jumped out at me was that there's a considerable difference between the percentage of girls who are accessing at least 1 hour of exercise a day and boys. So 30% of girls, 43% of boys. In addition, if we look at the differences between girls and boys of those who are accessing school mental health support, it's also quite different. So I guess one question for me around that is that 26% of girls accessing school mental health support and only 15% of boys, does that tell us something about the actual state of their mental health, or is it about their willingness to access support? So that's an unanswered question, but there's something going on there. And there's also something going on about the difference between girls and boys that are accessing that physical health. And of course, that has an impact not just on their physical health, it also has an impact on their mental health, because we know that there's a significant link between exercising and being active and young people's mental health as well. And we know that mental health needs increased significantly during the pandemic. If we look at health inequality across children who are accessing free school meals and not accessing free school meals, you can see really significant differences in the example of how many have been to the dentist within the last 12 months. So 64% of children on free school meals said that they'd been to the dentist in the past 12 months, and 83% who weren't on free school meals said they had been. So you can see a very significant difference there. And there's a number of reasons why people might be on free school meals, but the biggest one is around the economic status of the family in which they're living. If we think about current or previous users of e-cigarettes, sometimes referred to as vapes, I think technically that's correct, Simon, isn't it? There's a significant difference between those children on free school meals using or having used vapes and those who are not. In fact, it's more than double. I think that's very significant and something which needs to be addressed, and indeed is being addressed. Simon referred to the smoking cessation, and indeed the chair did earlier as well, the smoking cessation policy, which also covers that. If we think about children and young people with special educational needs and disabilities, and we go back to the school mental health statistics, so 35% of children with special educational needs have accessed school mental health support, against 25 without. We do know that those young people who do have an additional need quite often have additional mental health needs. And we also know that depending on the severity of those learning disabilities that they may have, the ability of practitioners to understand and support those mental health needs is more challenging sometimes. But certainly the mental health of those young people we have who have an additional need is something we need to be considering. And if we also look at those young people who have special educational needs or disabilities and their use, either current or previous use of cigarettes, this isn't vapes, this is the more traditional type of smoking, it's more than double. So if you have a special educational need, you are more than twice as likely to have smoked cigarettes either in the past or now. And that's something we should all be very concerned about. And I also just wanted to highlight the need to consider health inequalities within our children who are in care or who have been in care in the past, because we know that they often do not have as positive health outcomes as those children who are not. And of course, we're all responsible for that in terms of our corporate parenting duty. So if we just go to the next slide, Simon, thank you. These are just some of the things that are happening within children's services which have an impact on how we are addressing those health inequalities. So the first one is around the development of a new education strategy for the island. So we're aiming to publish a draft new education strategy for the island, which will consider how we as a council are going to be working with schools, early years providers, colleges, and everyone else involved in the education system on the island over the next 5 years. So it's a strategy through to 2030. And of course, there will be a big element of that will be driving up academic outcomes, but it's also about broader well-being of children and young people. And we know that, of course, there's a real link there as well, isn't there? Because if our children are healthy, both physically and mentally, they are better able to learn. And there's a really big link there between what's happening within our schools and health inequalities amongst our communities. The second thing is that we're in the midst of completing a self-assessment of provision on the island that does support special educational needs and disabilities. That's something that happens within schools, early years providers and colleges, but it also, of course, happens within our communities as well, because children and young people spend a lot more time not in school than they do in school, because school finishes at 3 o'clock in the afternoon, 3:30 in the afternoon. What are they doing between then and bedtime? What are they doing at weekends? And what are they doing in school holidays? So we're assessing not just what happens in school, but we're working with colleagues, for example, across the Integrated Care Board to assess what is the support like, what are waiting lists like, where do we have gaps in provision to make sure that our outcomes for children and young people with special educational needs improve beyond where they are at the moment. And that self-assessment around our SEND provision is feeding into the education strategy and the approach to special educational needs will be a subset of that holistic education strategy, which we're aiming to have out by the end of the summer term, this term. The third example of what's happening is we are making some changes to the way that we address our corporate parenting responsibilities. So, for example, there was some training that happened last week around for our elected members to make sure that they are aware of those changes and their responsibilities. And the fourth area is around working with colleagues in the council. We heard reference to working with more closely with adult social care that Simon H mentioned. And Colin and I were also talking yesterday actually about access to leisure centres. So we know that, for example, health inequalities for children with special educational needs they're not as good as we would want them to be. So what are our leisure centres like for those who have disabilities? How accessible are they? Are they places that everyone in our community feels comfortable and welcome to visit? So we're looking at that, although the initial look is quite positive, actually, in terms of the investment that the council has made in the past about making sure those facilities are as accessible as they can be. And an example of working with partner organisations, I could reference a number of voluntary sector partners that we're working closely with who are very active in this space and do some brilliant work. So thank you very much to our voluntary sector colleagues for everything that they do in this space for our children and young people. Thank you.
Thanks, Ashley. And then I think we'll just move on to Campbell, who's online, and Steve Parker, and then we'll have a leader on. We can open up for discussion after these couple of slides.
Yep, thank you, Simon, and hello everyone. I'm Cam Todd. I'm Deputy Director for Population Health and Health Inequalities in the ICB. So I'm just going to give you a brief overview of the NHS approach to tackling health inequalities, and specifically talk about healthcare inequalities. So this is more around the focus on our NHS services. So the first thing in terms of our overall purpose, it's about closing the gap in healthy life expectancy between the most and the least deprived areas, and also improving the number of years that people live in good health. And really that's a shared purpose across a number of partners. In terms of our vision and our strategy, we focus particularly on 3 areas. So on access, experience and outcomes. So the emphasis is equitable access, excellent experience and optimal outcomes. We also have 5 high impact actions that we're required to take in addressing health inequalities. So the first is around restoring services inclusively, and that's recognizing that we have a number of challenges post-COVID in backlogs in our services and an access to our services, and that's particularly focusing on primary care and elective services and urgent care. The second high impact action is around mitigating digital exclusion, and that's recognizing that post-COVID a lot of our services have moved online, so it's making sure that we still give people choice about how they access our services, so we're not widening inequalities by restricting access. The third high impact action is about ensuring robust data sets, and that's recognizing that if we don't have good data, then we can't understand our populations, and there's a particular emphasis on improving ethnicity recording. The fourth action is around accelerating prevention, and it was great to hear your mention of smoke-free and smoke-free generation earlier, and also Simon's approach to weight management. So they're shared priorities with the NHS, smoking, weight management and alcohol. And then the fifth high impact action is about strengthening leadership and accountability. So that's making sure that we're accountable at board level right through to the delivery of our services, and that we're transparent about the work we're doing and the change that we're making. There's a number of delivery frameworks that we use to deliver these priorities. One of those is the Core 20+5 framework, which I'll come come on to explain a little bit more in the next slide. We also have the NHS oversight framework, which has a number of measures which NHS England requires to improve against. And those areas are things like cervical screening, flu, MMR vaccination, and cardiovascular disease. We're also required to take account of inclusion health groups. So those are particular populations that suffer higher morbidity and mortality and die at an earlier age. So that, for example, would be people experiencing homelessness, asylum seekers, refugees, etc. We're required to take a population health management approach. So that's really an improvement approach using data and insight about our populations to improve services. And then all of that is kind of specified within our ICB joint forward plan. So that's our 5-year plan for the Integrated Care Board and also our shared system strategy. There's a number of levers and enablers to support us to do that. So the first is tackling health inequalities is now a strategy duty for the NHS. So that is for the Integrated Care Board and all of our NHS providers. And we have a core data set that we use to understand inequalities in our population and take action. Every NHS board is now required to have an executive lead for health inequalities, and that provides a direct line of sight really from the board to services. ICBs are also assessed on our strategy to delivery, and providers are, and there's a forthcoming CQC assessment of integrated care systems, which the Care Quality Commission is currently developing. We also need to think about how we use our money in different ways, and Simon earlier mentioned proportional universalism. So that's about how do we weight our resources to areas of higher need. And then the final area is about working jointly with partners, and particularly public health, and Simon and his team, doing all this needs to be done in partnership. The NHS can't do it on their own. The next slide, which I think is in your pack, is a bit more about the core 20+5 framework. So this is the healthcare inequalities framework that we use within the NHS. The core 20 bit is about focusing on the 20% most deprived using the index of multiple deprivation. The plus bit is around priority groups that we work together as a system on, and I've listed those plus groups for adults and both for children and young people. And then the 5 really is the clinical areas and actions that we'll take to close the gap in health inequalities. And the reason those areas are important is those clinical areas contribute most to the gap between the most and the least deprived. And there's a framework for adults and also a framework for children and young people that kind of outlines that. And then the next slide is really just a chance for Steve and Natasha and others to just give some local examples around the core 20+5 delivery mechanisms that are happening on the island. So I'll hand over to Steve and Natasha.
They don't appear to be here.
Okay, so should we move into a discussion? I mean, I think for me, that was a kind of whistle-stop tour of all of us thinking about inequalities. Leader and colleagues around the table, sorry, I realise online it's a bit more challenging, but I guess it's just reflections from board members. Where do they want to see some more focus, and how do we really think about tackling health inequalities as a key part of the Health and Wellbeing Board going forward? And I think if we just picked 1 or 2 things, it might be that those are the things that we then kind of go hard at on the island. Over to you, leader.
Thank you, Simon. Deb, are we finished before I come to you? Are we finished with your presentations? Thank you, Simon. Just before I come to you, Deb, thank you all for that. A couple of, if I may, a couple of comments. First one is a practical one. Could I ask any of the people that have presentations that we have those documents into the council on the day of this meeting at latest. It is quite difficult, even with 5 and 6 foot wide screens here, to see some of the detail. And I know that some of the members sat in the room were struggling to read some of those slides. That's not a criticism. It's just, could we have that provided to our democratic services so we can print them out or provide them electronically?
Hands up, my fault. Yeah, of course, leader.
Thanks, Simon. And then just, I guess, a general comment, a couple of comments, if I may. Yes, Colin, please. Thank you. Good to see you here for us to understand that transport and infrastructure is actually part of health delivery and health inequalities in our communities. So thank you for being here. Thank you for your offer. We will take that up. There are some specifics in the detail that you did a whistle stop on. We'd like to pick that up with you outside of meeting and bring that along perhaps in more detail at future meetings. Thank you for that offer. We'll take you up on that. Second one is, if I may, a comment and then something more specific. I spent some time around the gyms with our chief exec, our leisure centres, and was interested to hear that since COVID, there's this is in terms of children, Ashley, there's been a growing demand from 13 to 16-year-old boys and girls to attend the gym. Now, I won't make any suggestions why that might be, but it's quite interesting that those numbers have increased, and I'm saying that in context of some of your comments, Ashley, about health for our children in schools. It may be for other reasons that they're doing that, but I think it's worth noting that there is quite an increase in the council-owned leisure centres anyway. And then finally, if I may, on the dentistry, and we know dentistry is an issue, but dentistry, particularly for children, and I noticed that free school meals, more people who are not on free school meals are accessing dentistry. There's an inequality there. The Chair of Health Scrutiny has advised me that he's been in discussions with the ICB, who you may know about this, Ashley, who appear to be offering some funding to deliver some dentistry services into schools. I'm raising that, Ashley, and I wonder if we could take that a little further in terms of what the offer is and whether there is a potential opportunity for us to roll out some kind of more equal service of dentistry in schools. I don't know how operationally, but I wonder if you take that up with either the Chair of Scrutiny or the ICB or both. Thank you. Debbie, and then anyone wants to comment, we'll come around for comments or questions.
Thank you, Chair. I have mainly 2 questions, and I'd just like to thank everybody for those presentations. As Chair said, it would have been helpful to have them in advance, but there's obviously a lot of information to take in, but thank you for those presentations. My first question is really more of an observation with my experience working in children's services. We know, as Ashley quite rightly highlighted, that there is a very strong correlation between physical well-being of our young people and mental well-being. I do know that some work has gone on to make mental health services in schools more accessible, but I think there is still, and I think this is where we need to dig deeper into that data, there is still a stigma attached in the way that our young people are accessing those mental health services. So I think that's something that we need to consider, a way that they can access them, that they don't feel that they are necessarily signalling to their peers that they are accessing them. So I think that's maybe a little bit more work on that point. My other point is to Cam. Thank you for your presentation. It's something that I have raised in other boards, that the ICB is doing some great work, but it's very much, to my mind, a top-down systems approach. And how can we be sure as a board that the data is being analysed in a way that drills right down to place and is specific to not only the island as a whole, but those of us who actually live here know that there are great variations within the island. So what I would like to see is within any strategy, within any systems approach, that there is very much, it's top down, but also bottom up from a place perspective. Thank you.
Thanks, Debbie. That was a point. There wasn't questions there, was there? You were just speaking, weren't you? Yeah, thank you. Cam, and I'll come to you. Cam first, and I'll come to you, JB.
Yeah, thank you, Chair. Yeah, and I agree, Debbie. It's really important that we get data down to your neighbourhood level, beyond your place. It really needs to be at that much lower level, because the inequalities are very local, and they differ between local places. So I agree, and we need to get much better at that. So I do take that on board. We are doing lots of work at the moment around integrated neighbourhood teams with primary care networks and our primary care teams, and that is really looking at a very neighbourhood level around inequalities, and working with partners around beyond just health and health services, voluntary sector, local authorities, etc. So I think that will be a really good opportunity to do that much more neighbourhood, very local work, hopefully.
Thanks, Cam. JB, indulge me. Simon, would you speak first, please? And I'll come to JB after.
That's very kind, and thanks, Councillor Bacon. I think one of our pushbacks that needs to be cammed through you to NHS England is that things like vaccination data, we only get it by ICB level. That's not acceptable. We need to know on the island for the island. So can we, please push that back up the line? Screening data now, we get a huge system level. It doesn't help us. So I'm worried that with more ICB things, that's going to go that way. So can we make a note that as an Island Health Wellbeing Board, we need island data, not system data?
Thanks, Simon. Just to reassure members of the board that the three authorities, Portsmouth, Southampton and the Isle of Wight Council, the three leaders and the chief execs are looking at this in terms of representation to the ICB, exactly on that point about local place in the whole structure. JB.
Thank you, Chair. Well, having indulged you, I'm going to thank you further. I was actually going to raise the dentistry point, but just to mention that Councillor Lilly has spoken to me about this briefly. We're trying to arrange a proper meeting about it, but he has already sent a number of emails, copied in Simon and Ashley. So the issue is a live one. It's definitely to be pursued. Thank you.
Thanks, Jonathan. I forgot to mention that on the adult social care presentation, just a comment on that in the council budget in February this year, there was £500,000 set aside, 500,000 for digital schemes and projects to deliver into the adult social care. That will be, but that's being looked at. I'm not sure if I'm not sure. Laura's not here, the Director of Adult Social Care, but it's being looked at in terms of how best that money could deliver the best outcomes for our community. So that's £500,000 of extra money gone in through this council's budget in February. Any comments? Look, health. This is a huge topic. already encompassed by transport, adults, children's, public health, and pulling apart some of this so that we actually get down to be able to deliver and address some of these inequalities is a huge challenge for all of us. We have to show some leadership from here in how that gets delivered out into our community. But look, any comments and questions at this stage? I do feel that there is much more to be done in specifics on what we've heard today. But any comments and questions? Jill, it looks like you'd like to speak.
Thank you, Chairman. Most people laugh when they hear what I'm going to say now, that I'm the chairman of West White Sports and Community Centre. I don't do any sport. However, we have the way that we work is that we work with our community. So it's not just about sport, it's about welfare. We have Our Place, which is something that we link to that, which is around people needing help. We get different people coming in to support that. And I think it's, when we're talking about sport, it's much more, isn't it? We're talking about the whole of the West White, really, work through West White Sports and Community Centre, and it's the community centre bit that is so critical. So you've got the swimming, the sport, but you also have that support of particularly our over 65 people. And it makes it a little, I can't describe it, but it makes it, the people that come to that really identify with that being their place. It's their organisation, and they, you know, we had real problems in November, I expect you know, with young people doing an awful lot of destructive work. And what we did is we got a boxing coach come in. It's gone right down. They're coming in and they're using the rest of the sports centre as well. And that we're still getting a bit, but nothing like we were seeing just before Christmas. So I think it's how you integrate all that health and care into the community is really critical, because that's how it works. Thank you.
Jill, great work you do out there over many years, and good to hear the community stuff. I noticed that notes are being made about to dealing with antisocial behaviour. You brought in a boxing coach, and the police are making a note of that. I hope that I hope that moves on from there. Thank you for that. I'll come to Simon, then to you, Ian.
Oh, I was just going to make some suggestions on what we could do to take this forward, leader. So does Ian want to go first, and then I can just kind of bring this paper to a close?
Ian.
He said,
Okay, so I'm sorry, yeah. Ian.
Reluctantly, Chair. I've made a few notes, and you get the statistics every week, like I do, with regards to bed and breakfast and the number of children that we have in bed and breakfast. Hopefully being educated, hopefully being able to do their homework. We have a number of families in caravans. You've probably got it there, Chair. I haven't got it with me. It's probably on, yeah. And it's shocking. Never goes below 30 children in bed and breakfast. We have a churn. So I'd like to put that forward as one of my major concerns is how the heck do we hope to give hope to our young people when they're subjected to that? I've heard nothing about rental providers, the housing associations, in our conversation, yet a heck of a lot of our population are housed through the RPs. DLUC and central government have actually gone now and said, okay, you have to upgrade your housing stock. I haven't heard here as yet how far the Isle of Wight has progressed, let alone Hampshire. But I haven't heard, how are these RPs progressing with their upgrade, making the houses warmer, bring them up to 21st century standard? We don't know. We don't know what the investment is that's gone in. We don't know the housing numbers, and we don't know the families involved. And when Councillor Andre is saying bottom up, that's what I want to hear is, okay, what impact are we actually having? An impact assessment should be done. I'm going to go, I've got a list here, and I'm sorry I'm going to take a bit of time, but I will be succinct. All for a change. All I'm going to, silly JB, don't laugh. All I'm going to say is that we're sat around here. We haven't heard from the rental providers. This is supposed to be our house for people on the Isle of Wight. Every one of us sat around here knows of people in housing association or RSL accommodation. Every one of us. That's how it comes into our society. It's integrated in there. We don't know what they're doing, or I haven't heard what they're doing. Perhaps that's a stat that Natasha and Steve were going to give, who aren't here. But I mean, I don't know. So I'm concerned about the lack of input from our rental providers into the Health and Wellbeing Board, because we know we've got temporary accommodation. There's no tomorrow. We don't seem to be able to crack it. Yet you know, there is a problem there. I'll just move on. Well, we've got the household support fund now, thank goodness. Late after we set our budget. But I will say that we recognised that there would be a shortfall, and we made provision in the budget, tight as things were, to put a few £100,000 into a community support fund, and that is still there. And we're open to people to come forward and see what we can do to assist the processes. So we have got that. It's not an ongoing thing with the household support fund, because quite honestly, that's only going to run for 6 months, according to the central government, until suddenly there's an election and we find that someone's going to put something else in its place. So we're already doing our bit, but we need to be a bit more clever with the way that we're taking that forward. But we've done that as £500,000 from the Isle of Wight Council into that, and into the place plan and town and parish councils, helping them and taking them forward. So there are things there, but we need to dig in deeper to get to impact assessments on what's going on with the rental provision on the Isle of Wight. And I think that's an area we should be drilling down to. Noting that the ICB have got housing on their radar, I'd like to know a little bit more about what that actually means, what the impact is, and how we're faring with their contributions. Where is that going? What are we doing with it? Or what are they doing with it? I see core 20 plus 5, and once again, that group, the group in there are actually targeting those that experience homelessness. It's a great headline, good strap line, but I'd like to know what that actually means for our island, both in finance and in impact of what we're doing, how we're hitting the targets. And I'm going to leave it at that. I could run on for a few more minutes, but I won't. I see everyone's getting agitated. So rest assured, we're not doing enough to actually look at our housing and the factors involved in temporary accommodation and those young people in bed and breakfast, and what impact it is on their mental health and indeed their education. Thank you.
Thanks, Ian. I'm going to come to Joe, and then Simon wants to. We need to move on because we have other things on the agenda. Michelle, did you just want to mention that or not about help?
No, it's fine.
No, okay. Ian, thank you for those comments. We appreciate housing is a vital part of people's health and part of inequalities. I would have given you, in fact, I will. He said, as of Friday, and I suggest, as in previous health and wellbeing boards, housing becomes a matter for discussion. It is important, Ian, and thank you for raising it. As of Friday, there were 33 children in B&B accommodation. B&B could be a caravan or a hotel room. We had 202 families in temporary accommodation. This is of last Friday. And we had 44 single people in temporary accommodation. That's the extent of it's effectively, I have to be careful with my narrative and language here, effectively homelessness, but those involved in homelessness wouldn't see it as homelessness, but those people are in homelessness. They are at a disadvantage, quite clearly. And Ian, in his role as for housing for this council, has worked enormously hard and just trying to deliver 1 or 2 houses or 10 or 20. It's extremely difficult, but we're working on that. Joe, I'll come to you, and then you, Simon. We'll move on. Thank you.
Thank you, Chair. This is my first meeting, and I wasn't going to say anything. I'm conscious I'm learning. However, thank you for the presentation. I thought it was really interesting. I'm not getting a sense of what the wider system element is. So I felt I got a really good understanding of what is happening within the public sector. So we had presentations that included from Public Health, the Isle of Wight Council, from the ICB. But I didn't get any sense really of how the voluntary sector fits into that system response about health inequalities, and what the voluntary sector is currently doing to support that. And I think that would be a really good thing to look at going forward in terms of next steps. And that was really my next question. What are next steps? And somebody talked about providing leadership. I think it was yourself. And I think one way that that could happen is that all providers could be much more closely monitored for the role that they are playing to address health inequalities around their contracts, because I'm only talking about our contracts, but although it's there almost as a subtext, it's not overtly spoken about as part of that monitoring, and that might be quite a benefit.
Thanks, Joe. Very valuable commentary there. Simon, over to you, and we'll move on after. Thank you.
Yeah, so really helpful. So firstly, Councillor Stevens, yes, housing is a key part of our Health and Wellbeing Board strategy because it's so linked to health and wellbeing. And just asking the Simon, can we have a more focused topic at the next board on housing and health and really bring that back? We've done it regularly. I think for me, following this presentation, we need to focus on a key topic. And just thinking about what's fed through a number of those presentations, I wonder if we think about inequalities and physical inactivity, which felt like it touched what Simon said, what Ashley said, and what we heard about leisure. I think, Joe, you're right. There's something about how do we measure inequalities in all our presentations at various boards. I'm not going to speak for the Health and Care Partnership of the Island, but I'm wondering if Michelle and I can work together on what is an ask for Health and Wellbeing Board and the Health and Care Partnership on how we identify inequalities in relation to the items being brought forward. And also, Joe, we can help develop a framework so that we can really support commissioners and providers to measure that. My final kind of point is actually anchor institutions, which is the next item on the agenda, is something that we can do together, and that does help tackle inequalities. So, you know, we are primed to leadership, but we haven't done this item before. So we're in the early stages of tackling health inequalities. And I think we should say there's a lot of work to do, but we've done, you know, we are working on this agenda already. So I'll take those actions forward with partners to make sure the next board presentation working with Marie is on housing, and we've done some of the work in the background to give an update at the next board. Would that be okay, Leader?
Thank you, Simon. Appreciate that. And it will be good as we move forward to see some of our aspirations and strategic approaches, as Joe referred to, turn into delivery. So we'll work on specifics as we move forward on some of these board meetings. Can I move on to our anchor institutions? 7, it's to receive a presentation from Fiona. Go ahead.
Just give us a minute to share the slides. There we go. Okay, thank you. Good morning. My name is Fiona Maxwell, acting consultant in the public health team, and I'm going to be joined this morning by Hilary Todd, on screen, Associate Director of Occupational Health and Wellbeing with Solent, and by Max Nicol, Community Wealth and Special Projects Officer, Isle of Wight Council. One moment. Sorry, just an issue with the screen sharing. I think I'll just carry on anyway. Together, we're going to be talking through an overview of, here we go, of, next slide, Max, of anchor institutions with a particular focus on the relevance of anchor approaches in the context of work, health and wellbeing and economic development. And you'll hear from Hilary and from Max about current and ongoing work on the island. There are a few definitions available to describe what anchor institutions are fundamentally, although they vary in some of the detail. Essentially, we're talking about organisations which are large and influential in their local economy and community, which have resources. Which have resources in terms of buildings and facilities, and which employ people and buy goods and services. Anchor approaches is really about how those institutions and organisations can use their resources, financial and physical and human, and they can adapt and target their normal activities in ways which adds benefit and value to the community in which they operate. In other words, they still need to employ people, they still need to buy goods and services, they still need to maintain infrastructure, but they can do so in such a way that benefits health and wealth and well-being and addresses inequalities in a targeted way. We're just working through definitions here. An alternative definition from the Centre for Local Economic Strategies, that's CLES, places less an emphasis on the idea of anchor institutions being fixed or permanent presence, but still highlights the same characteristics of anchor institutions as employers and purchasers and owners of land and other assets. However they're defined, fundamentally, the theory developed from observing practice, and in the NHS context, that was first mentioned in the 2019 long-term plan, where there was recognition of the value of some of those approaches. Hang on a sec, looks like we're working down to help. It's still not, okay. So they referenced an early pilot project in Leeds, where the local NHS Trust made the decision to focus its employability in schools outreach and apprenticeship programmes on the most deprived 1%, I think it was, in their community, and increase their apprenticeship programmes offer to that community. And the long-term plan in 2019 also stated a commitment to developing those approaches in future. So we're on the next one. There we are, health and work, connecting employment and health, that's it. So I said we'd focus on the area of work and health, partly because we don't have all morning, it's a big area obviously, but also because this is one of the most important areas and one where significant opportunities do exist to use the resources of anchor institutions to benefit people and our communities. The relationship between work, which is obviously a key determinant of health, and well-being is a complex one, but fundamentally being in work, being in good work, which is secure and safe and where employees are treated fairly is good for physical and mental health and well-being. It provides the means through income by which people can make choices, choices about what they eat, choices about how they spend their time, choices about where they live, but it also provides structure and social interaction for many people and a sense of purpose and productivity. At a population level, we see that the distribution of areas where there are high levels of economic inactivity will tend to correspond with patterns of high morbidity and premature mortality. Of course, there are barriers to work, and this is why one of the essential principles of anchor institutions is so important, which is actively considering those barriers which mean that there are inequalities in people's ability to access work and productivity. In other words, the people most at risk of poor health outcomes are often those people who are least empowered to improve their own life choices through accessing productive employment, or are most vulnerable to losing employment if they do have it. We have a fairly high level graph here. I'm not sure how well you can see it around the table there. The Public Health Intelligence team have been doing some recent work. This is very much just a headline on a whole island level. It does need some further investigation. The data from the Public Health Outcome Framework, but this shows recent trends in levels of economic inactivity. In England, the black line at the top compared to Isle of Wight, obviously the blue line below. And the key trend there seems clear that post 2010, 2011, economic activity on the island was not able to recover to quite the same extent as in England as a whole, and seems to be continuing to decline. As I say, we can't fully explain the reasons behind this, and there will likely be considerable regional variation depending on the types of employment available and the demographic characteristics of any particular region. But I think this probably does serve to illustrate the unique challenges faced by an island economy and the need for a tailored, intelligence-driven approach to building economic activity. Many of you will probably have seen the next slide before, or a variation on it, but I always find it helpful to sort of summarise those key impacts and effects of separation from mainland for an island and other remote and rural economies, whether that be to do with the physical geography and distance, the range of opportunities available locally, or the specific needs and characteristics of the island population. I think it is a brief run through, but I think as anchor institutions, we do have opportunities to work both as individual organisations and also importantly together to build and protect community health and wellbeing and address inequalities through supporting people to access and stay in good quality work. I'm going to hand over now to Hilary, who'll talk about, among other things, the 350 Plus programme, which has been working to engage young people in particular to think about careers and opportunities within the NHS. Hilary, we'll do the slides from here, if that's okay.
Thank you. Thank you, Fiona. So as previously mentioned, I'm the Associate Director for Occupational Health and Wellbeing here at Solent NHS Trust, but also I'm the Senior Responsible Officer for the Education to Employment programme, which sits across the whole of Hampshire and the Isle of Wight. I don't intend to go through all the slides in detail, but just as an introduction, the 350 programme is a careers-based programme that introduces the 350 careers in the NHS, but also engages with students about wider health messages. The Hampshire and the Isle of Wight T-level support is supporting the development and implementation of placements throughout the Hampshire and the Isle of Wight, and specifically on the Isle of Wight. So you will see there about the specifics about our engagement on the Isle of Wight. We provide support into the schools and colleges, and create a number of opportunities for students to talk about careers, but also the wider Healthier Me sessions. Our T-level support, which is the next slide, please, Max, is we talk about this at both national and regional events about how to develop T-level placements in both health settings, but also beginning to have discussions about how we can provide T-level placements in wider settings. So T-levels, students need to complete 450 hours of employment placement through their programme. They can work across a number of organisations, so there is the ability to work in care homes and in the NHS sectors, or in businesses. If a student is doing a T-level business and admin course, they don't just have to work with one organisation. And we have been taking part in some research with the Gatsby Foundation, which is a philanthropic research program into how T-level students can lead into the workforce of the future. Next slide, please, Max. We've just been commissioned to provide support for care leavers and support the Care Leavers Covenant in Hampshire and the Isle of Wight. And we will be working with organisations across all sectors to ensure that we provide support to care leavers. One of the areas that we are going to work with, which is slightly different from other initiatives, is that we're going to work with the wider personal advisors. So we provide education to personal advisors who can then pass on that information to care leavers rather than working only with individual care leavers. And we plan to provide a programme that will start in at least year 10, 11, and then into college. So that earlier intervention, so that care leavers can begin to think about where they might want to work when they actually leave care. And then finally, just to we have a dedicated parents and carers page on our website, and that links into also engaging with parents of children who those parents themselves might have not considered a role in the NHS. So there's links to apprenticeships, there's links to the skills boot camp. There's more information that actually parents as well as students can access. So thank you. Back to you, Fiona.
Apologies again, Chair, for technical difficulties. Fiona did a brilliant job of covering that, and unfortunately what the board wouldn't have seen was some broad definitions of what anchor institutions are at the beginning of the slide, so quite happy to share those afterwards. But what we're trying to emphasise is that individual institutions and organisations have the ability to shape things within themselves, but collectively we need anchors to work together so we can affect that wider change. Again, you've heard from a couple of the directors sat around the table today about strategies that they're working on and developing. Again, that will affect change within the Isle of Wight Council and things within our influence. But what we're hoping to do with the development of working with other anchors on island is actually to foster collaboration, develop that opportunity for shared learning and intelligence, and reduce duplication of work, because time and time again we see that on island, that actually we're already working on something that our partners are already doing and we might not be aware of it. And sometimes rather than duplicate it, we can work together to save resources, because we're all well aware of the pressures on public services. The Health Anchor Learning Network has already identified widening inequalities, growing pressures on public services, and actually it's raising the question that public sector organisations need to work together to tackle some of the big issues. But in order to do that, it's identified these 5 key points in terms of anchor work, that good partnership working and buy-in from stakeholders is absolutely essential. Senior leadership support is also the enabler. Planning is also key, but it's the capacity is one of the biggest challenges, and so is the time. We see that from national examples that actually, and Hilary mentioned that support from the Gatsby Foundation, that places where anchor networks have been successful have got external funding, they've got philanthropic support, they've got backers. We unfortunately don't have that on the island at the moment, but what we're hoping to do is work together to solve some of those issues. So what's the bigger picture? Well, this comes from community wealth building. That is essentially, in simple terms, creating a resilient and inclusive economy for the island. So that's what we want to do. And how are we going to do that? Well, we're proposing that actually working together with anchor institutions, that's the mechanism to develop community wealth building on island. There are already successful examples. The most famous one nationally is the Preston model. There's also huge work with anchor networks in Manchester. Several have also started work in London. And the benefit of that is the wider social value. And for purposes of this board, it's seeing that greater health and wellbeing benefit. So that is through apprenticeships, that is through jobs and training, that is through upskilling people. So what are we doing on the island? Well, again, you've heard what's within our control. The Isle of Wight Council, it's essentially already in the corporate plan, all bar name. Community wealth building is essentially an approach that redirects wealth into communities and provides opportunities. So within the corporate plan, there are already various points that allude to that. It's about strengthening the island economy and making it an inclusive place. How can we do that? Well, already we've worked with the Centre for Local Economic Strategies in 2022 into 2023. Then Director of Strategy, Wendy Pereira, commissioned CLES to work with us to look at how we could develop community wealth building on island. So that's actually led to my post being created recently to help with policy and strategy development, but also embed community wealth building practices within the organisation. But in order to have that wider effect, we need to start looking at what we could do on island and potentially explore the appetite for an island anchor network. Again, that work that we did with CLES, we did have initial conversations with some of the key institutions on island. We then engaged with the NHS trusts, the ferry companies, Isle of Wight College, etc. And everybody was keen to work together because they had shared priorities. And many of them you've already heard about already in terms of low wage economy, housing being an issue, and actually encouraging people to come and live here and work and contribute as part of the community. So what could an island anchor network potentially look like? Well, I've kind of alluded to it already. It's about large organisations on island. So that could be us, that could be working with the trusts, the ferry companies, housing associations, college. But also, unlike in a lot of other areas, there's no reason why we can't work with private businesses because they have a significant local presence. They've got a stake in the community. So we are talking about GChem, we are talking about Vestas, we're talking about typically the largest employers on island, but also with substantial procurement budgets and that purchasing power. Because again, it was slightly missed in the technical issues with slides, but in order to develop an anchor network and to help support and sustain jobs and economy, one of the key ways to do that is looking at progressive procurement and how we could market shape things. So again, we've got lots of examples of how they've done it on the mainland and within different local authorities of people working together to create opportunities for jobs and growth, whether that's retrofits, whether that's cleaning contracts. There are all sorts of things that we could collectively look at together to work on progressive procurement. And again, just kind of ending on shared priorities, that would be for the network to decide. So again, when we had some workshops year before last, we looked at a statement of intent, and I could briefly read it to you because it's only a couple of lines, and this was very much a draft, but the draft was: the anchor network has been established to support participating organisations to maximise the benefit they bring to the Isle of Wight economy, both individually and collectively. Anchor organisations are major economic agents. By collaborating on key areas of work, specifically procurement, employment and management of land and assets, they have the potential to play a powerful role in shaping the future of the island's economy. That's the end of the presentation. Thank you, Chair.
Thank you so much for the presentation. We will circulate after the meeting digitally the slides. So thank you for that presentation. Appreciate the information. I did notice the one at the end about third or fourth slide, which takes a while to understand this. I'm probably taking a while to understand how this works. Although the idea of working with some of the larger employers, that's what it seemed to be saying, employment companies employ people in terms of their size rather than their commercial value. Does make sense as an island but how we capture that and exactly what you want them to deliver, I'm not quite sure yet. Any comments or questions on that presentation, which is interesting? Yeah, please do.
Am I on? I am, yes. Thank you, Max, for that presentation. I think we're probably the largest of the anchor institutions on the island. And I'm sorry, I don't have a name. I'm Joe Smith. I'm the Chief Officer of the Isle of Wight NHS Trust. I'm really interested in this. We have reached out a few times to people around this subject. We're really keen on developing that kind of framework on the island, particularly important for us in terms of tackling deprivation as well, because key to deprivation, of course, is giving people a route out of poverty. So we're really open to that. It's really refreshing to hear that somebody's now going to take the lead on pulling a network together, because I think if we did work together, there are opportunities to bring jobs onto the island as well. And I know that there have been opportunities for the trust to be able to do that, but we just didn't have the capacity to be able to reach out onto the mainland and bring it over. So if we were able to develop something like that, I think we could bring actual employment onto the island as well and create more jobs.
Thank you. It's encouraging to hear that. Ashley.
Thank you, Max, Fiona, and Hilary. From a children and young person perspective, this is full of hope. I think it's really exciting, and thanks for all the work you're already doing on it. I have had the pleasure of meeting a young person actually who's on one of these related schemes up at the hospital, and fantastic opportunity for young people. A few comments. I hadn't seen that map before with the scissors on it, but it's very helpful. Looking forward to have the slides because I can think where I can use that in other things. All the work around T-levels, working with schools, it's fabulous work. Loads of overlap with other strategic priorities. So, for example, the Care Leavers Covenant, this is fantastic. Also, the link to having specific information for parents to help parents support their children in all this is really, really important. I've heard already in my short time here about how parents and carers and children and young people would like more information about things, because often there's really great things out there, but people don't know enough about them. So fabulous that you've already prioritised information for parents and carers on that. A couple of things for the future. So we heard about T-levels and vocational pathways for young people. One of our priorities you've already heard me talk about is around special educational needs and disabilities. And I wonder whether you've got something specifically to support those young people who have additional needs and need that extra support to get them into work and be as independent as they can be. So, for example, do we have supported internships as well as internship opportunities? Do we have supported apprenticeships in addition to apprenticeship opportunities? Because those young people, where we have a statutory duty to support them up until at least they're 25, you know, anything we can do to help them be as independent as possible, develop their employability skills and get into paid employment as much as possible would be really, really welcome, and is a really significant overlap with other things we need to do. And in terms of the purchasing power, procurement opportunities that the council has, the NHS and other employers, and how we can engineer social value into those contracts. So how we can include opportunities to ask our providers to include supported internships, supported apprenticeships, working with our care leavers and give them opportunities would all be really, really welcome as well. So thank you very much.
Thank you, Ashley. Thank you for your commitment also. Joe.
Thank you. And again, thank you for the presentation. Can I ask, do anchor institutions just have to be larger organisations? Because if we're looking at our sense of place, traditionally the Isle of Wight doesn't have significantly large organisations, and there are significant numbers of much smaller SMEs. And so I wonder whether for the island, if we're thinking about how this is developed, we could think about that, and whether part of anchor institutions is also about culture and attitude, and obviously from where I'm coming from, about support for young people into employment. And for example, that could include commitment to apprenticeships, because that doesn't just have to be in large organisations, and that can be in the voluntary sector. And we traditionally don't have large organisations on the island, which are voluntary sector organisations. The other thing I wanted to just ask, I thought it was an excellent project that's going into schools, but there is already a reasonable amount of support that takes place while children and young people are still at school. And I want to ask about what is being done to support our NEETs, so those who are not in education or employment or training, because they appear to significantly fall through the gap at times. And again, if we're looking at this, it would be great to make sure that that cohort of young people are also considered alongside this. And there are about 500, approximately 500 young people on the island who are currently on universal credit who need to be supported into employment. And many of those probably have some level of mental health need as well. Which brings me to my last point. I'm here to represent the voluntary sector, but I do just want to let people know that the Youth Trust is working in collaboration with the Isle of Wight Council and with the DWP, and will shortly be launching a scheme to work with children and young people who are not in education, employment and training, to try and look at how do we integrate wellbeing and mental health support with their employment coach situation, to try and ensure that the outcomes for those young people are more successful and that they do get into employment and they stay into employment. So I would, from a Youth Trust perspective, be really keen to be working with you on this.
Thanks again, Joe. Appreciate those comments. Shall I move to Simon? And if you want to read Simon.
I was going to say really helpful, and I think as a Health and Wellbeing Board, we really want to support this work because of the links to health and wellbeing. Yes, there are many other benefits to the island, but we're focusing on health and wellbeing and recognise that. And Joe, I think your point about small institutions is really well made. It's how we start with the large ones who've got more, as this slide says, more buying power and more power, because and actually bring others on board, because that enables smaller organisations to benefit from the larger ones. So yeah, absolutely, and I think we support this work, leader.
Yeah, thank you, Simon. Is there anything you want to add, Max or Fiona, and we'll move on if not?
Just in response to the first point about is there any reason why voluntary sector, etc., couldn't be included? Short answer, no. There is no agreed definition, which is why I've put one of the definitions back up on the PowerPoint. We selected 3 to demonstrate that actually there's key themes regardless of how you're describing anchor institutions. Like I said, it's those organisations that have a significant presence and stake within the community, which is why when we started exploring this in 2022, 2023 and engaging with some of those potential anchors, it was about who could affect the largest change on the island. And we were looking at that through procurement and spending power. And again, in terms of how we get that added social value, our former procurement manager relaunched the Isle of Wight's procurement strategy in, I think it was November 22, to specifically include community wealth building as a part of that, to demonstrate our commitment to working with small and medium-sized businesses and getting lowering barriers for them to enter for good. So no, there is an awful lot of work that can be done, but we very much are at the start of this. And already I've heard from lots of people on the board, particularly talking about strategy development, etc. I think this is a key opportunity for us as an organisation to start ensuring that all of this is embedded into all of those policies and strategies going forward, so that if we do have a standalone community wealth building strategy, which we then use to engage with anchors, that we can actually say as an organisation, we're already doing this ourselves. We would like you to take this on board within your organisations and help facilitate it across Ireland. But in terms of your second and third point, I'd have to check with colleagues, but quite happy to get some responses back to you.
Okay, thank you for that. Ian, very quick, and then I will move on.
Music to my ears, this. You remember, you know, we already decided during this administration that we'd move down a community wealth building line. Going back to the previous administration we were in, we also had our memorandum of understanding with the Chamber of Commerce to try and move things forward, and also our renewal of the accord with the Federation for Small Businesses. And I think that's a statement of intent from the Isle of Wight Council that we need to move forward. We need to move forward with the NHS and other players, and take it on board what Joe said over there. Yeah, why not the voluntary sector as well? They've got a lot to offer. Thank you.
Thank you. And it's true. It's a multifaceted, multi-layered issue, and all of these things are part of the whole that we're here to try and do, which is improve the health and well-being of our community. And it's digging down, not necessarily from the board, but we can push down our hopes, aspirations, and directions, so that the individual components somehow mesh and come together to have a community-wide approach to it all. And we're all trying to do that. I think part of the trick is capturing all of the different things that are going on to deliver a holistic approach to health and well-being. But we'll move on, and thank you all for that contribution. We'll send the slides around. Our next item is drugs and alcohol from harm to hope. It was Sue Cochran, but I understand Simon, in her absence, Simon will present this to us. Where you go, Simon.
Yes, apologies again, Leader. It feels like it's one of those days. Poor Sue is dealing with a poorly child. So I wanted to bring a quick presentation. You've got a very detailed paper, so the presentation does cover that rather than being a separate issue. We have a duty around drugs and alcohol as a system, and I'm the Senior Responsible Officer, and as a Health and Wellbeing Board, some oversight of that is welcomed and required. So I'm just going to give you a quick summary of where we are with the new drug strategy. I should say at the outset, we were given 3 years money. That ends in April 2025. We have no news if the increased funding on drugs and alcohol will be there. If the money doesn't carry on, we will have to then reduce service provision. But we are waiting for government announcements, and that's obviously quite challenging. So, and the second point there, around inequalities, we know people are more likely to use alcohol and drugs if they live in a deprived area, and it really impacts on housing, employment, and those kind of things. So we also know people have co-occurring mental health issues and substance misuse, and I think we need to think really carefully about that. Some really successful programs in different parts of the patch where we can learn from. And back to smoking, we know a number of people will smoke if they're using drugs and alcohol. How do we really help those people give up tobacco as well? This gives a model estimate of the number of people who are drinking over the recommended limit. And at the end, there are some actions we can all take to think about that. And then you can see the illegal drugs there about opiate and crack users, and how do we really think about helping those people get into treatment. Treatment works, treatment's effective, and we can do it. So what are we doing about it? And we've got colleagues in the room from the service. There's service-specific questions, but we're working with our recovery hub on the Isle of Wight, based in Newport, provided a number of things, including prescribing, group activities, but also a really good volunteer program. So people who come through the service then get trained as a kind of peer supporter, and then they can go on to get jobs. So it's about that kind of through flow. It's not just about getting off drugs and alcohol. It's about that next phase. We work with schools and colleges really well, supporting staff to raise their awareness. And also we have support for families. It's so important that those parents particularly, or those family members supporting someone in treatment or using, even if they're not in treatment, they get help to know how to help their loved one. So we have a delivery of the National Drug Strategy, and that's got four priorities. One is about prevention, working with our criminal justice colleagues, improving our drug treatment, and we've done an awful lot of that. And the number of people in treatment in the last 2 years has gone up, and that's great news. And then focusing on that unmet need. So our key achievements is here, and I'm really proud of the work we are doing and leading. The number of people I said has gone into treatment has gone up by 20% there. We have targeted services for those who are homeless, and that's really, really important, and shows we're thinking about those groups are more likely to need extra help. The other one I'll just focus on at the bottom is micro elimination of hepatitis C. So actually within the service, we have eliminated Hep C, and that means we test everybody and we get, it's a very high percentage on treatment and through treatment. So that's a great achievement by our service. And I'm really proud of working with inclusion. So what next? We are about raising awareness further. Part of this presentation, improving pathways, really working with our service users. They know what's needed. We listen to them and do a lot of co-production work, and then looking at how we can do this if the national funding ceases. We are still awaiting information, and I suspect politically we're waiting a long time for that. Oh, I thought there's a slide on what we could do together. Apologies. Oh, here we go. So what can we do together? I'm not quite sure. When I put it up there, it doesn't work. Sorry. So consider the language about how do we use drugs and alcohol, reducing stigma. We really need to think about that, our language, and we've got a language guide we're very happy to share, thinking about how we support people into services. We have a very good, nicely named alcohol quiz. Rethink Your Drink is really good at helping people identify if they are drinking more at risk levels, and then raising awareness of our services, and then how do we link with pathways. So Leader, I'll stop there as a fair canter, but I just wanted more time for discussion, recognising the time of the meeting, and you've got a detailed paper.
Thank you, Simon. Interesting. Before I just come to some comments, Simon, the figure of 20% increase, it's a number, but is there any indication behind that, why that increase happened?
Yes, because we had increased funding, so we could increase our capacity and our outreach. So we did both of those things, and then we got more people in treatment. So it was, a real combination of the new money and how we used it in a very careful way.
Thank you for that. Any comments or questions on this? Debbie?
Thank you, Chair. If I can just pick up, Simon, on the work that's going on in schools. Can I just ask, obviously there will be situations where children are in environments where parents are potentially affected by alcohol and drugs. So can we be reassured that the work that is going on in schools actually tackles that element, and it's not just focused on children as users, because obviously they are passively affected as well?
Yes, absolutely. Support for family is key. And sorry, I should have said, that includes children. But obviously, if there's someone who's in that situation, probably linking very closely with Ashley's team around safeguarding as well, to make sure they have the safeguards if they're a child or someone who is using drugs and alcohol heavily.
Just one more, just to highlight, you mentioned that the current commissioning with inclusion is due for renewal next April. We've got a paper, haven't we, coming to Cabinet in July on procurement.
There are two things there. Sorry, one is our money, the national money. So our ring fence money that we've had for since 2013 will remain, but the increase in funding that we've had, we don't know about. But we are going to bring a paper to Cabinet to discuss the next phase of service provision on the island.
Thank you, Simon. Any other questions, comments? Simon, without, may I just say, can you can give us confidence? I don't want to know the numbers and it's your decision, but you do have some discretion on them. And I realise money is not the only factor involved in all of this, but that your commitment through your budgeting spend on these alcohol and drug abuse continues at a pace.
So the funding for the services run on two bits. One is the increased grant I've mentioned. The other bit is the public health ring fence, where we have a duty to spend on drugs and alcohol, and the government asks how much we spend on that. So yes, absolutely committed to use the public health grant in the right way for this purpose.
Thank you for that clarification. Any further comments? Simon, thank you for that. Thank you for stepping in. Thank you for the interesting information, data on that, and it's something we will revisit, I'm sure. Can I therefore move on to members' question time, if there are any? There being none, Therefore, 11:29, let's call it 11:30, we will close this meeting. We don't have a date for the next one, do we? We will notify you of the date of the next meeting in due course by email. Thank you all for attending. Safe journey home. If you're a long way away, safe journey.
Many thanks, Leader. Apologies again for being online.
Thank you, Simon.
Thank you, everyone. Bye.
Cheerio.